Saskatchewan Health Authority will soon post temporary emergency room disruptions on their website at least twice a day at 9 a.m. and 4 p.m. The provincial government directed the SHA to make the change, which will be effective on May 19th. Jeremy Cockrell is the Minister of Health, and he's spending a couple of minutes with us this morning. Before we get into the emergency room topic, which is very, very important, there is another thing that we're celebrating today, and I like to end Fridays on good news. So you'll be in Saskatoon later today to celebrate Air Ambulance.
Yeah, it's the 80th anniversary of Saskatchewan Air Ambulance. Daryl, it's actually the oldest non-military medical transport program across North America. We've got 4 planes, transport about 1,500 patients every single year. Just an incredible service that we have here in the province.
What does it mean to us to be able to keep that going? So everybody thinks of Air Ambulance, they think of STARS, right?
Yeah, I mean, obviously, we've got a great partner in STARS providing the rotary wing service. We've got Rise Air providing service to less acute patients. But for those 1,500 patients that use the fixed wing air ambulance service every single year, it means they get the right care at the right time. And that makes all the difference for patients and their long-term outcomes.
All right, so let's talk real-time information on our healthcare system, ER closures. You don't want somebody driving from Weyburn or Rollo to Weyburn or whatever it has to be, whatever the situation ends up being. Why can't that data be posted in real time?
You know, I think people can understand, especially those who work in the healthcare system, there's a ton of moving parts in terms of if we're coming up to what we might see as a temporary service disruption in a community, the Saskatchewan Health Authority and their operational teams go through a lot of steps to try and avoid temporary service disruptions. We try and put other staff in place. We try and provide other coverage. We try and, utilize programs like the virtual physician program and point of care testing to make sure that we can cover off those services if we do think that there's going to be a disruption. So again, we went last in the fall, we went to once a day reporting on disruptions. Now we've directed the Saskatchewan Health Authority. We need to have those updates at least twice a day. But it's important to note, we noted in the news release and as well in my scrum yesterday, we actually at least twice a day as a minimum. And if we can do it sooner, that would be the goal as well, to provide as real-time information as possible. But, I hope the public can understand that there's a lot of moving parts as we work to avoid disruptions and put those services in place for people.
I think the real answer here is recruitment and retention. Where are we with that?
Absolutely. I was asked yesterday, what do you hear from municipal leaders across the province in terms of this issue? When I meet with municipal leaders and patients from across the province, the priority is how do we get more physicians? How do we get more nurse practitioners? How do we fill the nursing vacancies that we may have in our community? That is the priority of our government, and our Patients First plan is actually addressing the issues that cause the service disruptions. We don't want to have temporary service disruptions in any facility across the province. We've seen really good progress on the nursing front in the last couple of years. We still have some work to do on the physician front, but I think some of the things that we've put in place over the last couple of months in terms of additional training and residency seats for physicians, as well on the nurse practitioner side, more incentives and more training seats there. I think, we're setting ourselves up for some positive years ahead on that front.
Jeremy, thank you so much for a couple of minutes today. We will say thank you to our first responders and happy 80th to our air ambulance service here in the province. Jeremy Cockrell is the Minister of Health in the province of Saskatchewan.
Thanks, Joe.